go ahead and declare a state of emergency to enact some provisions that we feel like will keep our citizenry here in Lawrence County safe and healthy. I'm going to read a short breakdown of the actual declaration, and then Dr. Kraft from the Public Health Department and Don Avery from Fairview Park Hospital will also be on hand to say a few words and answer any questions. So basically, at 11 a.m. Thursday, March 19, 2020, the Lawrence County Board of Commissioners met and declared a state of emergency in Lawrence County due to confirmed cases of the COVID-19 virus. Like I said earlier, this action was taken in conjunction and consultation with our local Board of Health as well as our local municipalities. Very important that everybody understands that this declaration includes provisions that will prevent social gatherings of 10 or more people. These social gatherings includes church services, funerals, family reunions, meeting up in the parking lots, cookouts, things of that nature. All of those issues will be applicable under this provision. It's not that we're trying to scare people or be overbearing, but people need to take this very seriously to protect our citizenry health. So please, abide by those things. There will also be a curfew in effect from 10 p.m. to 6 a.m. Each day for non-essential travel. So if it's for business-related traveling, those things are okay, but just traveling from your friend's house or back and forth to the store after these times will not be prohibited. The Sheriff's Department, the Dublin Police Department, the East Dublin Police Department are all in agreement and will enforce these provisions of this order. Again, this does not apply to businesses. If you have a set of businesses with 10 or more employees, this will not apply to you to keep you from doing that. This will be against social gatherings. Okay, can't make that clear enough. We hope everybody abides by this declaration, and we hope that very soon we can cancel this declaration. But until that time, if you hear from anybody else, it will be in full force. I'm going to turn it over now to Dr. Thomas Kraft of the District Public Health Department.
Hi, my name is Dr. Thomas Kraft, and I'm the District Health Director for the South Central Health District, which is one of the 18 public health districts in the state of Georgia. I wanted to begin by saying that we've had 2 positive Georgia Public Health Lab confirmed cases of COVID-19 or coronavirus 2019. Both of these are residents of Lawrence County, and both of them are currently being treated at Fairview Park Hospital. According to our procedures, all close contacts are being followed closely by the Department of Public Health surveillance protocols that we have in place, and we'll continue to monitor each of those contacts extremely closely to monitor for signs and symptoms and respond as appropriate. I would say at this time there's no known source identified for these cases. So with that in mind, this would be considered community spread at this time. So with that being said, I'm going to turn things over to Fairview Park Hospital and let them give you further details at this time.
Thanks, Thomas. I'll just say simply that we've had protocols in place for several weeks to ensure proper precautions are taken by our employees. I think many of you know that we have implemented visitor restrictions. Each patient can only have 2 visitors, adult visitors. They're screened to make sure that they're healthy, and they have to be identified by the patient ahead of time. If a patient is suspected of having COVID-19 or if they've been identified as having COVID-19, they will be allowed 0 visitors. In our emergency department, we're allowing only 1 visitor per patient, and again, adult patients only, so you have to be 18 or over to visit anybody in the hospital. We have had 2 cases. These patients are under isolation, have been under isolation, will continue to be so until they recover sufficiently to go home. We do have a couple patients under investigation in the hospital to determine if in fact they have the COVID-19 virus. And we've had these over the past week, and up until last night, all have tested negative for the virus, and now we have those. We continue to work under CDC guidelines. We utilize and recommend everybody follow CDC guidelines. We do that very carefully. We work very closely with Dr. Kraft, Jennifer, and their staff at Public Health locally, as well as state organizations, Georgia Hospital Association, et cetera. So we're taking, again, all those precautions to ensure that our employees, our medical staff, visitors who come through are as safe as humanly possible. So be happy to answer